trendafricatv@gmail.com. 33120318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa. Hello, everyone, and welcome to the health segment on Trend Africa TV. I am your regular host, Empress. But for now, I would like to urge everyone to please share the feed, invite your friends and family. And as we all know, today we're going to be getting some updates about COVID-19, the way forward in terms of medication and what phase we are now in Illinois. And from there, we'll be talking to an OBGYN who will be talking to us about a very important organization and some questions about uterine fibroids. Right now, we would take a little break and urge everyone to share, like, invite, whatever you can do to the feed. Just do it and we'll be right back. Don't touch that dial.
Hello, Dr. Amina. How be?
Adeo, Adam. How be you too?
How we go do am? At the course sake of the other time you talk, say you go explain the vaccines thing give me.
Oh yeah, so everybody get immune system which they protect we from infections, right? Take am say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines there, we start to use no be today. If the vaccines help we fight the 6 childhood killer diseases safe.
So why people they talk say vaccines no good?
I tell you say no be true. Vaccines be safe, wah. Some people they react badly to vaccines, but that be rare cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. It no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure time soon?
Righty, research advance wah. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why them won't try the corona vaccine for only Africans wanna talk?
The French doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we no gonna know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, before make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, me too so I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kai how you go protect your body from corona.
Oh yeah, at the Kaiwa, I will stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Hello again, everyone. Good morning, good afternoon, good evening. You are wherever you are in the world. I'm going to be joined by my regular panels. They are all professionals, like I always say. I'm going to be joined by Mrs. Eunice CROMWELL, who is a family nurse practitioner. She provides continuing and comprehensive healthcare for all ages and genders, while emphasizing on disease prevention. She's also the financial manager of the Ghana National Council. Mrs. Eunice CROMWELL, thanks for joining us.
Thank you.
Secondly, we have Dr. Edward OFORI, who is in the middle of a meeting, but he ran out to just come and join us for a few minutes. So we're going to ask him real quick what's going on in terms of treatment with COVID-19. And he's going to run out and run back, and he'll be going. That is how dedicated he is. So we really appreciate Dr. Ofori for joining us. Dr. Edward Ofori is an assistant professor of the pharmaceutical sciences at the Chicago State College of Pharmacy. He is a professional pharmacist and a researcher in mental health and neuropsychiatry. Dr. Edward Ofori, thank you so much for joining us.
Right, thank you and for having me.
We wouldn't like to take any more of your time, so let's go ahead and please tell us where we have gotten to in terms of the vaccine to eradicate COVID-19.
All right, so I'd like to thank everyone that is tuning right now and listening to us, that the fight for COVID-19 and treatment is still ongoing. We still don't have any form of treatment for the disease. Right now, we're all looking at up to a possible vaccine that is going to kind of help us, like we always have to resort to in most cases when it comes to infectious disease. So there's been about 4 big clinical trials going on now. Johnson & Johnson just launched another one for COVID-19 vaccines. And most of these are in the phase 3, I should say. That is where we actually give the vaccine to a larger population of people to find out if it is effective and also if it's safe. It's still currently ongoing. We don't have any approval for its use. Also, we do have remdesivir, which is one of the, I would say, small molecules or small drug molecules, which are not vaccines, but an actual therapeutics that helps with treatment of COVID-19. The emergency use of this medicine has been expanded to include anybody that is hospitalized. So before now, it was actually reserved for people that were having severe symptoms of the disease, meaning that if they require some kind of oxygen or any form of, they have any breathing difficulties and needed oxygen. But now anybody who is hospitalized, the emergency use has been made to include that. Other than that, we also have steroids that are playing a major role in the treatment. Some people are also exploring other antiretrovirals like leponavir. In some places, we are exploring interleukins inhibitors to help some patients that will need it. And therefore, the scope of medicines that are used to treat the disease is expanding, but then it's not at the speed that we would like to see it. We are still hoping that the things that we do, like social distancing, the mask, can guarantee us, reduction in number of cases until we actually have a vaccine. And in fact, we are still going up a hill with vaccines, in the sense that a recent poll shows that it's only about half of the population that will take the vaccine, even if it's available at this moment. Part of the reason is because of the politicalization of the whole vaccine issue, especially in the United States, has contributed to this issue of vaccination and hesitancy in that regard. So if you ask me, that is all that I have in terms of update. We don't have any treatment approved at this point, but we are still waiting on a vaccine to be approved.
Dr. Ofori, I believe it is flu season right now.
Correct.
So is it advisable for people to get their flu shots now?
Yes, it is highly advised that we do get a flu vaccine, even though it doesn't guarantee 100% coverage. We anticipate that the 2 major outbreaks will probably cost a lot of lives, because most of it, these 2 diseases all involve the respiratory tract. So we are advising that at least we should get the flu vaccine. That doesn't mean that it's going to offer you protection against COVID-19, but then at least we have a vaccine for flu, but we don't have it for COVID. So it will be better for us to actually get a flu vaccine this time around, because of the way we don't have the grip on the coronavirus.
Today I got my flu shot today, and my manager, I heard her saying, after this flu shot, you guys are going to have to start getting ready to take the the COVID 19 shot,
Vaccine.
and then she was like, I am not going near that shot, Mauti, because I don't even trust it. I'm like,
Yeah. So that is a huge issue with, surrounding COVID-19. I remember when the swine flu and the H1N1, all those kind of pandemics that broke out, people were hesitant but then the numbers weren't this much, right? Because of the way this whole thing has taken the whole world by surprise, and the fact that, some people think the vaccine is rushed, it's
Yes.
like it needs to cook right.
Yes.
So yeah. So people who don't understand how vaccines are made think that it's too quick, and some people have stakes in it, and therefore they're now going to put their life on the line. I can understand, I definitely agree that some people will have some hesitancy, but the good news in the US is that the approval of every vaccine goes through what we call the advisory board. Unlike a lot of countries where they don't have that in place, they have an independent review board that doesn't have any political affiliation or anything, a group of scientists, a group of regulators, and all of that. And they will only guarantee something that is safe to start with. That is the only way that approval is going to go to the FDA. FDA alone does not approve vaccines. That is the only therapeutics that doesn't lie in the hands of the FDA.
Okay. So, Dr. Ofori, are you going to be hanging with us a little bit longer, or you're out for now?
Yeah, I'll be here till 7.
Oh,
so I have 20 minutes. Yes. Mm-hmm.
All right. So, is there anything else we are missing out in terms of treatment?
I would say there's nothing really missing in this sense, but what we have to do is, was said by the CDC director, that this is going to offer you more protection, even probably, than the COVID-19 vaccine, because we still don't know, right? So we encourage that at least people should wear the mask, in especially when they're going to an enclosed area. The disease is very infectious, and the only way to kind of mitigate or prevent the spread of it is try and social distance. The numbers are picking up again because, of course, we had a holiday, right? And after the holiday, usually after a week or two, you see an uptick in the numbers. So I'm not too surprised. It's just that we can reduce the positivity rate, especially in the US. It'll really help. But one thing I should commend is that Ghana has done very well when it comes to COVID-19.
How so? How so?
All indicators show that actually we probably would need a leadership of Ghana to come to the US to help us out. Because initially when we started, remember, I used to worry a lot. I was like, the way things are going, if this magnitude of spread hits back home, we are going to be in trouble. But it's the opposite, right? And part of it is the management. Part of it is the population that we have in Ghana. A lot of us are young, and it doesn't really affect a lot of people that are young, I should say. So based on that, we are kind of lucky in one sense, but then still we have policies in place that is really helping, even to the extent that people who go through the airports now have to be checked, right? Even though you do a test before, you still have to be screened at the airport, which is very good, unlike the US, when in the beginning we just allowed everybody into the country. Right. So yeah, so that's one thing that I should commend Ghana for.
So how is the curve looking right now? Do you know?
The curve is, it's not as bad as we had it in May or April, but then we still have, days of, like yesterday, I believe today's 24th, right? Yesterday had a very big uptick, right? And especially even in Illinois. So I think that we're going to have that up and down. Like somebody said, it's like, when there's a wildfire, right? And the whole fire, the inferno is gone. You have these spots of fires, and we need to find a way to quench those spots of fires, or I should say epidemics.
Thank you, Dr. Ofori. Mrs. Eunice Cromwell, any updates on COVID-19?
I think that what we really need to do is just encourage people, like Dr. Ofori said, to just be vaccinated. I feel like right now, because we really don't have any sure way of getting rid of COVID-19, a good protection against elderly people and people who have other diseases would be right now the influenza vaccine. One thing we have to bear in mind is that a lot of the symptoms from flu are also the same symptoms you're going to get when you have COVID-19. So I think it would be very nice if people would really go out and get the flu vaccine. I know some people just don't like it because they feel like it gives you the flu and that you get more sick when you get the vaccine. We must also be aware that when you get a vaccine, even though you may get a little bit sick with the vaccine, it's nothing compared to what you would feel like if you were to get the full-blown illness. So that is just some teaching that I've been doing for a lot of my patients. We just need to also remember to really do good hand washing and hand sanitizing. In the beginning of all this, all the stores that we went to, you couldn't really find hand sanitizer or like the wipes. But right now they have an abundance of it everywhere at Walmart, at Target. So we should stock up because, as Dr. OFORI said, it is going up and down, and they do suspect that it's going to get worse before it gets better. So instead of us waiting until we hear on the news it's getting worse and everyone grabs the toilet paper and everything they can see and spray, it would be very good right now if we start gathering those things little by little.
Thank you, Mrs. Eunice Promo. What are some misconceptions about the flu vaccine that we should target today? And then we can see a full picture of your beautiful face. So if you could just
I'm sorry.
tilt your camera to
Camera. Oh, here we go.
yeah, beautiful.
Sorry. Oh boy. Technical.
So what are some misconceptions about the flu vaccine? I know as a nurse, when I'm admitting my patients, when it's flu season, I'm supposed to ask them, would you like to have the flu vaccine now that you're here in the hospital? And one thing they say, oh, I don't want that because when I take it, I feel sick and I still get the flu anyway. We are under the impression that taking the flu vaccine prevents you from totally getting the flu, but that is not the case. That is not the case. So could you please explain in layman terms to our community the purpose of taking the flu vaccine?
So the flu vaccine in itself is going to help you to be able to fight the flu, right? So it's going to give you some of those antibodies that you need to be able to fight the flu. Now, it is very true that there are certain people who take the flu vaccine and they still get the flu, and sometimes they get it worse than ever. But majority of the people who take the flu vaccine, you will get sore. With all vaccines, sometimes you get that soreness in your arm. That is why it's recommended that we put it in the arm that you don't like write with. Put it like in your left arm if you're right-handed. But
Right.
all the benefits of you getting the flu vaccine outweighs you not getting it. So I always tell people, and I know some people are just afraid to get vaccines in general. There's a lot of conspiracy. Sometimes people think that they're injecting us with other things, but for the flu vaccine, as long as I've been a nurse, and when you're working in healthcare, it's something that we have to do by force. And yes, I have, been sore. My arm has been sore, but I've never had the flu before. And I've always got the flu vaccine. So with COVID-19, the way it is right now, I would be really, it would be wrong for me not to encourage our community to get the flu vaccine, because that's some good protection. And at least you'll be protected from that. And if you happen to get COVID-19, we have seen a lot of people doing well. I told you about my patient who's had it 3 times. I checked on her today. Unfortunately, it's been 3 times, but she's doing well. And so it's one of those things that we have to just really keep focused, keep on using our masks. We shouldn't get tired. We have to continue doing everything they say we can do until the time is we can go back to normal. But I don't ever think it's going to quite go back to normal. And the way I've seen like restaurants and everything handle things, we should be kind of grateful that people are really taking more precaution, because I don't know how restaurants and other places were really like sterilizing their stuff before this happened, quite honestly. It's been such a drastic change, and the fact that a lot of people complain about it makes me know that there was things that were just not right before COVID came out. So at least that has exposed that.
Well, last 2 weeks, Dr. OFORI was saying your patient that got it 3 or 5 times, it could be her house.
We want to keep her away from everybody.
Dr. OFORI, would you like to add to that?
Yeah, I mean, we are learning gradually that some people lose their immunity over time, right? Yeah, but yeah, like you said, it's very rare that you're gonna completely lose all your neutralizing antibodies, just like that. Especially if you have like severe symptoms and it's true for most infections. So, if she says she gets it 3 or 5 times, like I said, then we need to go and see, Obinim or somebody to pray for her. Yeah.
Okay, viewers, we're going to take a little break and then we are going to come in and we're going to introduce our guest. Don't go anywhere. Continue sharing and liking and inviting. Thank you so much. Stay tuned.
Ghana boy. No. She rank on, you pay myself. Ghana boy, yeah. Cause you come, you done me, oh. You tie me up, you treat me up, you tie me up. You tie me up, you treat me up, you tie me up. What do you feel when you're time way? I can't walk on, Nankamiko. What do you feel when you're time way? I can't walk on, Nankamiko. Listen me down, send me your button, what to tell me to down. Send me your button, more. Miss was me chose doing a mere she don't know, but I'm fighting me and whoa. Tell me your car, come and meet your mouth. Me your car, come and meet your mouth, yeah. Me your car, come and meet your mouth, oh. Me your car, come and meet your mouth, yeah. She rank on, you pay myself. Thank Ghana boy, yeah. Cause you come, you done me, oh. You tie me up, you treat me up, you tie me up. You tie me up, you treat me up, you tie me up. What do you feel when you're time way? I can't walk. What do you feel when you're time for when I can't walk on Nankamari? Listen, me down, send me your button, what to tell me to down. Me send me your button more. Me say was me chose doing a mere she don't know, but I'm fitting me and whoa. Tell me don't come and meet your mouth. Me don't come and meet your mouth, yeah. Me don't come and meet your mouth, oh. Me don't come and meet your mouth, yeah. She rank on, you pay myself. Thank Ghana boy, yeah. Cause you come, you done me, oh. You tie me up, you treat me up, you tie me up. You tie me up, you treat.
To the health segment on Trend Africa TV. I am your host, Empress MAWUSI. I am being joined by Dr. OFORI, Mrs. Eunice CROMWELL, and our special guest is Dr. Sam OWUSU. Dr. Sam OWUSU, are you there?
Yes, thank you.
Okay, so Dr. Sam OWUSU has been on this feed for over 30 minutes now, just waiting for the show to come on. Very, very excited about educating us. Dr. OWUSU, thank you so much for joining us. God bless you.
Thank you for inviting me. Thank you.
Can you please tell us a little bit about your profession? I know Eunice sent me about a whole booklet, and I can't read all on air. So you just
Well,
summarize and tell us
well, I'm what we call an obstetrician gynecologist. So I provide healthcare specifically for women. So I'm in the women's healthcare business.
Okay. So you have a foundation. You are founder of a particular special foundation. Can you tell us about that, please?
Right. So I'm the president of what is called the Ghana Medical Relief Organization. This is an organization that is focused on providing healthcare to villages in Ghana, and we've been around since 2011. It's an amazing organization, and if you get a chance, you can go to our website and see some of the work we've done. What we do is we put together a group of physicians and surgeons and other volunteers, and we always go to Ghana, and then we run medical missions in the villages. So, for instance, 2 years ago, we went to a town called Siakwa, and over there we had obstetricians, gynecologists, internists, pediatricians, dentists, urologists, and we just provided healthcare. We provided care for them for over a week for free. It was fantastic. Last year we did the same thing at Anumabo in the central region, where we provided care to over 5,000 people in the span of a week. And so for Ghana Medical Relief, and these are all volunteers from the States, okay? These are all physicians, and we are in central Pennsylvania, so we get to have students from Penn State and Hershey Medical Center who join us on this trip. So we go to Ghana, every year we pick a particular village. We go there, we stay there with them, and we just run clinics from the morning to the evening. And it's a wonderful experience for people who've ever been interested in mission work or in such programs. Now, so if we go to, say, Anumabo or any other village for that matter, a family comes to the clinic, dad gets to see the urologist, mom gets to see the OBGYN, Kofi and Amma go to see the pediatrician, and Uncle John can go see the dentist. And all of this is done in the same setting. And after that, they all just go to the pharmacy and pick up their medications. And so it's a comprehensive healthcare program, very different from what other programs have to offer. So it's really fantastic. And beside that, we also run seminars where we teach our patients. We have presentations on diabetes, hypertension, malaria, asthma. This is all part of our program. The other thing we also do when we are in these communities is we go to the churches and the schools and we teach them CPR. We have mannequins with state-of-the-art mannequins with all the bells and whistles. Last year when we were at Anumabo, for instance, we went to Agri Memorial and we screened every student in that entire school. We saw every one of those patients and we taught the students CPR. Moving forward, some of the things we want to do when we go to these communities is go to churches, schools, lorry stations and teach CPR. I think we were talking backstage about how important CPR is in our communities. The first step in first aid is CPR. And, when you have these horrible car accidents that seem to always happen on our highways, you come and think about it, CPR can save the lives of many people before we can get them to our tertiary institutions and our tertiary hospitals. So I think what we're doing at GMR is very important. It's exciting. I think what we're doing is bringing something new to the healthcare system in Ghana. We've also been able to work with Ghanaian physicians in the Ghana healthcare system who join us when we go on these mission trips and who work with us. And it's been a fascinating experience for us.
Thank you, Dr. OWUSU. So I would also like to find out from you, how do you gather resources for your mission? Because that would be a very, very challenging area to deal with. Right.
So I, for instance, work here at Manini Medical Center, and if you come to the hospital, and I work with an institution called Geisinger Health System. It's a 600-bed hospital, and if you go to the hospital, on every floor there's a huge box with my name on it, and whatever is not used gets tossed in that box. And every weekend, my wife and kids, it's a fun thing to do. I have a truck. We go and we pick up all these supplies, and we bring them, to my garage. I've never parked the car in my garage. I have a big garage, but I've never parked the car. and all we do is we sort these supplies out. And the people who are coming on that trip that year also come to my house, and we sort these supplies out, and we repackage them, and then we ship them. So usually the mission is in July. We do our shipment around March so that it's there on time so we can get our supply. And so when we get there, we have most of our resources. And then we also raise funds and we buy medications from here, and we buy some also in Ghana. We always compare prices. And the hospital always donates used equipment to me. So over the years, I have ultrasound, EKG machines, I have blood pressure. I have unbelievable equipment. We even have, what do you call it? Our equipment that costs thousands of dollars. So every time the hospital has to get rid of an equipment, they usually will offer it to me, and I'm happy to take them. So that's how we've acquired a lot of our equipment. It's really fascinating. Yeah, we're able to do surgery in Ghana entirely from used equipment that was collected here in the United States, all for free. It's amazing. It's fantastic how much we've been able to put together. And so my colleague, who is the dentist, also always looks out for dental equipment. And the urologist in our group also always looks out for used urology equipment. And we bring them all together, and we're able to, so knowing what we have, we purchase what we need. But usually, just from all the used equipment, I mean, remember, used equipments are just used equipment. Doesn't mean they don't work. We just use them. We buy gloves, and some of the new things we just have to purchase. But a lot of our stuff is used equipment that would otherwise have been discarded by these hospitals. Yeah.
So you being a male gynecologist, don't you get a lot of resentment from our females in Ghana, because
actually, I think that
dressing for a male to be.
Well, I think even in Ghana, most obstetricians and gynecologists probably are males. Unfortunately, and the good news is, this is becoming a women's field, rightfully so. But I think that when people are sick and need healthcare, they will go to wherever they need to go. I mean, it's the same thing here in the United States. I think when most people work in my clinic and see a big, tall, black African male, I'm sure they're intimidated. But once you start talking to them, you calm them down, you reassure them that you're there to provide a service and that this is what you do. They sort of come around. And if you do a good job, they'll tell their friends. So I think there's you kind of have to sell yourself a little bit. But at the end of the day, when people are sick and need help, they will get help where they can, irrespective of how you sound and how you look. I mean, that's just the bottom line.
Oh, okay. Okay, that's also okay. You're back. So we're having a little Wi-Fi connection over there. Okay.
Yeah.
So I guess you answered that question already. I did not hear it, but I guess my viewers heard it. Eunice and Dr. OFORI, do you have any questions for him before we go to our main topic?
Is Dr. OFORI still on?
Dr. OFORI left. Okay.
Okay. Well, first of all, I want to just say how excited I am to have Dr. OWUSU. I was really inspired listening to him. I actually learned about him through a friend of mine that was helping me with my own foundation in Anamabu. And as you hear everything that he was saying, it just really encouraged me to really, promote my own foundation and also really help the people back home. So really, really congratulations and God bless you, Dr. OWUSU. Dr. OWUSU, who's been really, really helping people tremendously. And the fact that you bring people from here to go there to experience Africa and to really help people, it's very admirable. So I'm really, really happy that you're able to share that information regarding his foundation. I put this link on our platform. If anybody wants to donate, they do have a GoFundMe where they're going to be raising money for their next trip, the next village they're going to be going through. So this is something that any little bit can help. Anything that you want to do to support, please, I encourage all of our viewers, let us support this thing. And also all of our healthcare workers, if you're interested in volunteering, there's also a form there, and you will definitely see me there because I'll be at the next one as well.
Great.
So excited. Thank you.
Thank you.
Okay. That's also, we would like to address uterine fibroids today. That is one area that our African sisters and mothers are suffering from. But we live in a country where majority we are mainly Christians, and people don't trust healthcare. They'll only come when they're after they've been to the pastor and it's not okay. I mean, they wait till things really get bad before they come to the hospital. So we would like to educate the community on uterine fibroids today. Can you please explain to us what uterine fibroid is?
Okay. Yeah, so thank you. So uterine fibroids, as and another name for it is called myoma. So basically, these are growth of the uterus. One, they are not cancer. 99.99% of uterine fibroids are not cancer. They're just growth. So the uterus gets really large. Now, if you think of the uterus, think of it in three compartments. One, there is the inside of the uterus, so what we call the endometrium, and that's what women shed every month and call their menses or period. And then there's the inner part of the uterus. That's where the muscle is. And then there's the outer part. Any one of those three parts, or any two or three, then that can get large. Now, if that happens, we call it a fibroid. As you can imagine, if the enlargement takes place with involving just the lining, then what happens is now the surface area of that lining is larger. So those women will have heavier periods or heavier menses or longer periods, right? If, for instance, the enlargement takes place only in the middle, then what will happen with these women is they may not necessarily have heavier periods, but every time they have a period and their uterus has to contract, it's more painful. If the growth is just on the outside and they just have a large, bulky uterus, and they will usually complain of fullness in the abdomen. So now, so think about it, when the uterus gets large, just as it happens, just similar to what happens in pregnancy, except in pregnancy, there's a baby, and that's why it's large. That increase in size can put pressure on your bowels. So most women will end up having trouble with moving the bowels. If that enlargement puts pressure on your bladder, most women will have trouble holding their urine. So they'll have frequent urination, things like that. If that enlargement happens to really focus on the lining of the uterus, then they'll have heavier period. So imagine a woman who has such a large fibroid and now requires transfusion every other month. That's a difficult lifestyle to live with. So that sort of woman will need some treatment. So any of these things obviously can be a problem and will require treatment. But at the end of the day, it's still not cancer. It's more of a lifestyle change that has to take place. And so that's, how, and again, it can be very small, it can be large. Most people with fibroids are asymptomatic. That means they don't even know they have it. It's something that sometimes can be, a physician doing a pelvic exam might say, your uterus is a little bit large. They can be as small as size of a pea. They can also be as large as basketball size. I've taken out ones that are the size of a basketball. Of course, those are impressive, and usually those women would say, hey, I feel this big mass in my abdomen, I know I'm not pregnant, right? So those are some of the ways that people will end up seeing a physician for this change in the abdominal girth or the abdominal size. But they are not cancer, but they're difficult to live with. I mean, I don't think that anybody wants to walk around feeling that they always have to use the bathroom because they can't hold their urine because they have this big mass in the abdomen. So those are the things that will sort of make people see a doctor or have that discussion with a doctor whether they need something done about it.
So, Dr. OWUSU, what are the risk factors?
Very good. So this is not, so some of the risk factors are, one, this is more prominent in African Americans and in Africans, probably because it's genetic. Okay, so that's one of the things. So, most people who have fibroids will tell you their mother had a fibroid, their auntie had a fibroid. So it's really genetic. Having said that, you can see it in all different, most white people can have fibroids too, but it's more prominent. This is not because of any particular food or drink or anything that, you can't blame it on that. I mean, there are people who've made a living putting out information about diet and things like that. We don't have any good evidence to show that any one particular diet will make you more prone to fibroids or anything like that. As I said, when you're pregnant, the uterus gets big, and it gets big because there's a baby growing in there and because of all the hormones that are being secreted in your body. So yes, there are people, so maybe being on some hormone therapy might make it larger, but it's usually not significant. So I don't want you to think that going on a birth control pill, for instance, will increase your risk of getting fibroids. No, that's not what I'm saying. That's actually not true. So they're really the only significant risk factor one should say is just, mostly genetic and, having a family history of fibroids in the past.
You said it is non-cancerous. Can
Right.
it ever change over and become cancerous?
That's very good. So if indeed it's really a fibroid, it wouldn't become cancer. Now, there is something called sarcoma, which is cancer of the uterus. Usually, what happens with that is in the beginning, we might not know it's cancer of the uterus. We might think it's a fibroid. Okay, so it's not, so, and that's always difficult to diagnose. You see, so because a cancer of the uterus also presents like a mass, it's very difficult to tell whether it was a fibroid that became cancer or cancer that was misdiagnosed in the beginning. But most fibroids, as we say, 99.99% are benign. As a matter of fact, if you have a fibroid, and if I examine a patient today and her uterus is, let's pick a number, 16 week size. We use gestational week to size, and then I see them in a couple of weeks and now it's double the size. Then it's probably not a fibroid. Okay, so that's what happens. We usually, if you have anytime you have a very rapidly growing fibroid, it's probably not a fibroid, and that is the kind of mass you want to get out and make sure it's not what we call a sarcoma. But if it's truly a fibroid, it will always be benign. But I think we usually misdiagnose what we call sarcomas as fibroids.
Thank you, Dr. OWUSU. Dr. OWUSU, in our tradition, when a woman gets married, one of our pride is giving birth. Your in-laws will be calling you names if you don't give birth. They will think you're a witch and all that.
Right.
And sometimes I talk to my friends and my family. Sometimes they're like, they said I have fibroids, I'm bleeding so much, but I have no children, and I'm scared to go see the doctor.
That's correct.
So I want to ask you, Dr. OWUSU, does fibroids cause infertility?
Yeah.
And how so?
Right, they can, depending on where they are. So, for instance, if the fibroid is inside the cavity of the uterus, right, then if you think about it, the surface area available for pregnancy to implant is decreased now, right? And so that can be a problem. Also, if the fibroid occupies too much of the space in the uterus, then even if you get pregnant, there's very little room for the baby to grow, and that too can cause miscarriages. But the good news is most fibroids that are outside the uterus, what we can usually do is we can remove just the fibroid without removing the uterus. It's called myomectomy. It's a kind of surgery where we go and we remove the fibroid and you still have your uterus. So not everybody who has a fibroid requires a hysterectomy, which is removal of the entire uterus. No, most young women who have fibroids, one can still get pregnant and can go through the pregnancy even with their fibroids. We know they have it, we keep an eye on it, and they still have the baby without even having any surgery. If we think your fibroid is so large that it's taking a significant portion of your uterus and we think it's going to affect your ability to get pregnant, we can remove just the fibroid and leave your uterus intact. Okay, so it's still something that is worth getting checked out. So absolutely, that's a good point. Yes, but not everybody who has a fibroid needs hysterectomy, and most women with fibroids who are having trouble getting pregnant should contact their doctor and have their options discussed with them.
So you are saying that a pregnancy and a fibroid tumor can coexist?
Absolutely.
Depending on the size.
Absolutely. And the location. We see that a lot. We see that. I've seen, so when I'm doing a C-section on a patient and she has a fibroid, at that C-section, I probably wouldn't even touch the fibroid. That's not even the time for it. That's a person who's been able to get pregnant and has carried a pregnancy at 10 with a fibroid. So that fibroid is not causing a problem. That is not the time to even take, even though it's surgery and I'm in the patient, I'm looking at the patient, I'm writing the patient's abdomen. That's not the time to take out the fibroid. That's because the patient can really bleed a lot at that time. That's something that can be discussed later if she's even interested in having the fibroid. But there are women several women who have fibroids and still can have several pregnancies and don't ever need to have it removed.
Okay, Mrs. Eunice Cromwell, over to you.
What I was going to ask is, you talked about how if it rapidly grows. So are you saying that fibroid tumors grow at a slower rate, like over time?
Yeah, they usually do. They usually do over time. If it's rapid growth, then you want to make sure it's not a sarcoma. As a matter of fact, these are the indications for when a woman should probably consider surgery. One, if you have fibroids and you bleed, you think your menses are so heavy. I mean, if they're too heavy, they're not. Excuse me, they're too heavy. If they're too heavy, then obviously, I don't think that anybody wants to get a transfusion once a week or once a month. So that's not worth. That kind of lifestyle is difficult. So if your menses are heavy, then you probably should consider having surgery, because transfusion once a month, once a week is just not an ideal way to live. If, for instance, the fibroids grow very quickly, we want to make sure it's not a sarcoma. And so that's also, as I said, so that's also something to be checked out. If, for instance, there is a drug called Lupron that we give women usually to shrink the size of their fibroid. If we give you that medicine, for instance, and it's still rapidly growing, then that's something to be worried about, because it could also be a sarcoma, right? If, for instance, your fibroids are too large, or they're to the extent where you think it's interfering with your bowel movements, or you being able to, you hold on to your, sort of holding on your urine, things like that, being incontinent, again, that's also something to consider. So these are the things that we look at and then based on that, recommend to women if they're interested in having surgery. But if a woman has a fibroid and it doesn't bother her and she doesn't have any of these problems, she really doesn't have to have surgery. There's no reason for that. Most of the time, as women get older and they get into menopause, because you have less hormone secretion, the fibroids usually shrink in size a little bit, and most women can live with it. But no, they don't have to have surgery if they don't have any problems with it. If it doesn't bother them, it shouldn't bother you.
And you mentioned that if someone's having a heavy period, so what if someone has more than 1 or 2 periods a month, like 2 to 3, I should say, if they have continuous bleeding and it takes a longer time to end, but it's still not like extra heavy, would that be something that could be a symptom of a fibroid tumor?
Well, sure. If anytime you evaluate a patient for abnormal bleeding,
uterine bleeding,
heavy period, irregular period, that should be one of the things on your differential diagnosis. And that's an easy thing to work up. I mean, when you do your physical exam and you palpate the uterus, if you find that the uterus is unusually large, that's when you can get an ultrasound to see if she has a fibroid. If she has a fibroid, then that's probably why she has heavy bleeding. And in that setting, again, if it's not very large, you can still do things like birth control pill, Depo-Provera, all kinds of things. You can have all kinds of medications for that, and that can help it. So yes, that would be on your differential. Yes.
I think one thing that's very important, especially as MAWUSI was talking about our culture, I think it's very helpful for, if a woman is going through this, to go to their appointment with their husbands, because I think that would cut some of the questions and some of the things that them thinking that something is really, really wrong with you. Because from the way you are explaining it to even two of us, we're 2 women sitting here. If it was something that I was going through, I would be much more comfortable and say to myself, okay, this is what Dr. OWUSU said. Let me take it one step. But sometimes the way people present things and you hear things, you become very, very afraid. And the anxiety of the fear of the unknown is worse than even the diagnosis itself.
Yeah, absolutely. And that's a great point. I mean, remember, when we talk about infertility, it's not always women. I mean,
right.
Yeah, sometimes, yes. I mean, we often forget that. But, when you work up patients for infertility and that semen analysis comes back, it can be a gut-wrenching moment for everyone. So, you have to do that. The infertility is not, the workup will tell you that, sometimes it's not the female who is the problem. I mean, you have to do your semen analysis, you have to work up the patient. The other things that you can do, and again, just a fibroid alone, may not be the reason why the patient is infertile. So, you're right. I think the best thing to do with these appointments is to bring your partner and have that discussion, and, have your husband or partner also be able to ask the doctor all the questions and get the right answers and the right information.
Are there any foods or anything that we can also do if you had this fibroid tumor? Is there anything that you can eat or should be doing to also reduce it? I did read somewhere that when you're obese, of course, they cause a lot of different comorbidities. But is this something that you can do to change if you did have one?
No, we don't. Again, when you do the literature search, there are people who've made a living trying to recommend all kinds of diet and exercise and things like that we really don't have any good evidence that shows that any foods or anything will either put you at risk for fibroids or improve your fibroid. So there are things that may increase your flow, but not necessarily the fibroid itself. Again, this is an abnormal growth, and there's not much you can do unless you can control your estrogen and things like that. So in pregnant women, for instance, if and when they get pregnant, the fibroid gets larger. But that's because the entire uterus is getting larger. It's the same way a tattoo on your belly will get larger when you get pregnant. It's not because that two all of a sudden started to grow, it's just everything, expands exponentially. So that's what happens. So no, there is really no good evidence of any food or drinks or obviously I don't know of any herbs that will.
I'm sure they have a list back home.
Yeah, I'm sure in Ghana, if you go to the lorry station, there's a drug there that will take care of that, as they always do.
Are there any myths that you hear that you want to get rid of today? Because I did read somewhere that teenage pregnancy puts you more at risk for having a fibroid tumor. Is that accurate, or is that just a myth?
No, it's a myth. There is no good evidence that's true. I don't know of any evidence that shows that having teenage pregnant. No, that's not true. That's completely false. That's completely false.
Very good.
Okay, Dr. OWUSU, you are really, really educating us. We will take a little break right now. Let's all go. The ladies are going to be powdering their nose, and you can go get a drink of water, and we'll be right back. Don't touch the dial, viewers. We'll be right back.
Thank you.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't say Corona really kill black people.
Make you not make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right here, it catch everywhere, where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie, some people say they talk say China people with shada do or it be 5G self where they cause them. But shine your eye, it no be anybody do where 5G too no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty, it just be upgrade. People too they talk say if you get Corona we chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but him too no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, Corona they feel worry them, papa. People too they talk say if you cut onions put your room, Corona no go come there. But Corona no they like mosquito, where go fit kill am plus coil.
Then how we go fit protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say get Corona, make go chop for one corner, so say no go spread them. If you get plenty rest, then drink more fluids. But if you make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, we will make sure say we go protect we, one our family, one our friends, then everybody from Corona. We all for play one apart, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all. But we for take responsibility and keep fighting with positivity.
Hello everyone, and welcome again to the health segment on Trend Africa TV. I am being joined with Mrs. EUNICE CROMWELL, Dr. Sam OWUSU, and Dr. Edward OFORI. Though Dr. Edward OFORI is attending to other businesses right now, he will be joining us again very soon. Right now, we will take this opportunity to read some comments online. Kuja Umawena is watching. Yayura Agboka is watching. Eddie Stone says Ghana medical relief and a thumbs up. MAWUSI Kumis, go Ghana medical relief. Michael Johnsberg says, good job, Dr. OWUSU. Benjamin Ankama, watching live from Kintampo, Ghana. I'm really learning new things, he says. Georgetta Erich, great job as always. Ibrahim Mohammed, please, does emergency contraceptives cause fibroids? And then Michael Johnsberg, also watching from Dompoasi, Ghana. My regards to you, Dr. OWUSU and Mrs. EUNICE CROMWELL. Dr. OWUSU, someone is asking, please, does emergency contraceptives cause fibroid? Okay, viewers, please keep your questions coming in and we'll be answering your questions.
Well, No, they don't. They don't. And that's something. Keep using them when you have to. No, they do not at all cause what do you call it? Fibroids at all. That's not correct.
Okay. So Dr. Wusu, what are some treatment options for
Right.
fibroids?
Right. So as we discussed earlier, one of the things we can always do is remove the entire uterus. Obviously, that takes care of it. But that's obviously in patients who do not desire future fertility. In young patients or productive age women who want to keep their fertility options available, we can remove just the fibroid. So, and that's called myomectomy. It's surgery where we just remove the fibroid so you can still get pregnant. Okay. The other thing that's available nowadays is something called uterine artery embolization, where we access the blood vessel to the uterus and sort of disrupt the blood supply to the uterus. When you do that, because you've disrupted blood supply to the uterus, that can shrink the size of the fibroid and can improve the bleeding. So in women who have heavy bleeding because they have fibroids but don't want to undergo surgery, this can be done as an outpatient procedure where we sort of disrupt the blood flow to the fibroid to the uterus, and hence decrease the size of the fibroid and hence improve their bleeding. Okay. Now, obviously, once you do that, that patient cannot consider pregnancy in the future because you've disrupted blood supply to the uterus. And so that's something to think about. Okay. So those are the sort of surgical procedures. If the fibroid is not very big and if the bleeding is the only problem, you can also go on something like birth control pills. Birth control pills improve, your menses. So if a patient has heavy periods and that's the only problem they have with the fibroid, putting them on a birth control pill can improve their cycle. And that sometimes is all they need. So if you can do that, that can also help. That makes a big difference. So we have we have medical treatment and then we have surgical treatments.
Thank you, Dr. Owusu. I want to find out, can a tumor rupture, or can it burst? Can it grow to a point where it can rupture or something?
No, because it's the entire muscle. So in the same way, so as the muscle gets bigger, so what happens with this? Think of the muscle, these are cells. They're getting bigger because they're making more of themselves. So they can never rupture. They can get so big that they put pressure on your bowels and put pressure on your bladder and make you incontinent and sometimes make it difficult for you to move your bowels. But no, they don't rupture. They just get bigger, and they can get as big as as far as they can go, as far as they can to fill your abdominal cavity. So it can be so big that it puts pressure on your diaphragm and kind of make it hard for you to breathe. Most people by that time will know there's something wrong with them.
Right. So like we know, breast cancer is usually in only women. Okay, but then mostly in women. But then we also know that men can also get breast cancer. Can men also get uterine fibroids?
No, because men don't have uterus. That's the beauty of it. They don't have a uterus. Thank God for that. So the same way a woman cannot get cancer of the scrotum. So men don't have uterus because you don't have a uterus. You can't. So that's not. Thank God that's not a problem with men.
Okay.
Yeah.
Okay. So I also heard that uterine fibroids can cause other kinds of discharges. Is that true?
Well, so if you have a fibroid, you can have heavy bleeding. And if you have heavy bleeding, some people will see it as a discharge. But it's really more bleeding. I guess you can call it a discharge, but it's not, so the discharge you have is usually from the cervix, not from the uterus. And remember, the uterus is connected to the cervix. So, directly or indirectly, sometimes I think you can mistake that one to be the other. But as far as uterine fibroids are concerned, they affect more the bleeding because they involve the lining of the uterus. The cervix is adjacent to it, so you probably can have some discharge because of that. But that's more directly from the cervix, more so than the uterus.
So how can men support their wives in? Because I know as women, once in a while we put on a little bit of weight and then we start feeling undesirable, and then there's no talking about how you would look carrying that mass in your abdomen, and you might feel very undesirable. What do you think our husbands or our boyfriends or our partners, what role can they play in helping us to deal with issues like this?
Yeah, just like we discussed earlier, I think the best thing that any of us can do when our spouses and loved ones need care is to go to the doctor with them and help them ask all the right questions, and also just by sitting in the room, sometimes you can remember some of the answers that were given by the provider. So when you come home and your wife says, I forgot to ask this, or why, you can sort of fill them in. The same thing you do when you have to go for a diagnosis of cancer or something. You take another person so they can remember some of the things that were said, not just what you heard. So,
Right.
so we should always support our partners and our loved ones when they're afflicted by something, and if we can show up at the doctor's office with them, it will be helpful so that they can remember all the options that were discussed and ask all the other questions that they otherwise would have forgotten to ask, and sort of make the conversation more complete. So support is everything. And I think, and sometimes just showing up, at the doctor's office with them is helpful. I find it very helpful when a patient comes to my office with their partner, because I can relate to the guy and I can sort of get him involved in the conversation. And it's helpful to let the guy understand that, listen, this is something that happens to a lot of women. It's not the end of the world. These are the treatment options, and think about it, and how will that affect you as a male, and things like that. So it's really, really important to sort of make the visit with your partner.
Right. We have a very let's read some of the comments online. Emma Owusu Kumi, we are so proud of Dr. Owusu. Guys, please donate to Ghana Medical Relief. We do great job in Ghana providing healthcare one village at a time.
Yeah. Emma is
Abigail,
one of those people we have people who've been with us 5 years in a row who come every year. There are people in central Pennsylvania who make it part of their yearly vacation to come with us. And it's one of those who've been with us just can't help it. I mean, they come every year. And Emma's one of those people who've been with us, last couple of years. She comes every year with her family. She has a daughter who is now going to pharmacy school. She brings, we have people who came with us who are now going into healthcare. We have 2-3 people who are now going to medical school because they were high school students and came with us, and some of them college students are now going to pharmacy school. Yeah, so her daughter, interesting enough, is one of those people who visited us, and we had her work in the pharmacy 2 years in a row, and she just got admission to pharmacy school. Isn't that fantastic? So this is really helpful for a lot of young people too. And as they work with us, we let them do some of the procedures with us. Last time when we were at Anomabo, we had a baby delivered on one, and all these young college students were just amazed, and it's helping them sort of make good career choices, I think. So, we're proud of the work we're doing.
Wow.
Absolutely.
Yeah. And it's also nice when we do these missions and all these young children in the villages see Ghanaians like myself coming back and working in that community as doctors. I mean, when I was growing up, every time I went to see a doctor, it was a Caucasian man from some country. It's nice that these young kids see us coming back as doctors. We speak their language. They know that we are just like them, and it is so reassuring and it's so comforting. And I think, in so doing, we indirectly become role models for them. We all need that in our lives. So it's not just we. The dentist is a Ghanaian, the urologist is a Ghanaian. A lot of doctors are Ghanaians, but we have a lot of other Caucasian physicians who come with us and nurses who come with us, and they really talk to these young people, and they love it. They love it. It's great.
Okay, Abigail on Wona. Hi, Dr. Owusu. Nante Shiwa Asama. Good job, Dr. Owusu. Dr. Owusu, you got a lot of fun.
Well, a lot of people. I'm meeting a lot of people for the first time, but that's great.
Wow. Mr. Candy Ghana, great show. Abigail says go Emma. So Dr. Owusu, let's talk about how we can so you were telling me you've already released the dates for next year,
right?
For people to sign up,
right,
for the mission, right?
Right.
Do you have a cutoff time, and do you have the amount of people you want to take, or it's just?
Yeah. So what happens is, when we go to a village, we want to see as many people as we can. So we don't have the more people we have, the more people we can give care to. So when we went to, for instance, we went to Anomabo last year, we saw close to 5,000 people. I mean, when the clinic is open, everybody is invited. We make sure we see everyone till, we go through the whole day and we see everyone. The more providers we have, the more care we can give. The more funds we can raise, the more medicines we can give and donate. As you know, we buy all our prescriptions. We try to do as much fundraising as possible. The people who come with us donate to buy drugs so we can give those drugs to Ghanaians. So not only do we pay for our own fare to fly down to Ghana, we pay to stay in hotels in Ghana, and we pay to feed ourselves in Ghana. We also donate money so we can buy medications and give out to the people when we go to run this clinic. This is all, we don't have any funding from the federal government or anything like that. We just raise funds and cover. So the more people we have, the more funds we have, the more people we're able to provide care to, and the more of the prescriptions we're able to, sort of dispense out. So it's really one of those. So we don't have a cut off. We certainly, but what we definitely want to do is be able to have a good head count earlier in the year, so we can arrange for accommodation and transportation and things like that. So that's where it's important, But usually, if somebody wants to make the program and sort of gives me heads up, I'll make sure I count them in. But like we have to make arrangement for transportation and accommodation. So head counts are helpful. But yeah, we usually, so it's in July, and we would like to know at least by May who's going to be able to make the trip or not.
Right.
Yeah.
So are you telling me that you provide accommodation for the volunteers too?
Oh yes. I mean, these are all foreigners coming from the US. They have nowhere to stay. I mean, we went to Anomabo, and we had 60 people. And let me take the opportunity to thank EUNICE. But EUNICE has a family member, Anomabo Beach Resort, who donated some rooms to us so we could stay there for free. That was unbelievable. That's the first time we've had something like that. It was unbelievable.
Go, EUNICE.
Oh yeah. EUNICE had a family member. Yeah. I mean, Mr. Dazi donated 10 rooms of his hotel for us to stay there for free, and that was fantastic. But yeah, a lot of the money a lot of our donation goes into paying for hotels, paying for transportation, and when we ship our stuff, we get to the port, we still have to pay to get it out. I've never been able to figure out why we have to do that, but that's a different topic for another day. But we pay to ship our supplies, we pay to get our stuff out of the airport, we pay for transportation, accommodation, because these are all people from the US.
This is so sad, man.
Yeah, they're from the US and they have nowhere to stay. So we pay to stay in hotels, and then we pay to get all our supplies and dish them out. So so accommodation is usual. So we want to make sure that we have enough we can have a head count so we can make arrangements for the what do you call it, so we have a place for people to stay. That's the big thing. Accommodation is a big thing for us. Yeah.
Mr. Parkwesi Sam is asking, can non-health professionals volunteer?
Absolutely. As a matter of fact, 30% of our staff are really non-healthcare professionals. People who come to this program bring their families, they bring their kids, they bring their spouses. Last year, we had a doctor who brought his kids, and his husband was a lawyer. We put him to work. So, I've been bringing my kids for years. I mean, my wife is a nurse. If both of us are going, our kids are coming. So I bring my kids. And so if you go to the website, you see pictures of a lot of kids, and we have work for them to do. So the kids sometimes will be the chaperones, So non-healthcare providers, we teach them how to do intakes. We teach them how to do blood pressures. They will sometimes work the kitchen. They will sometimes work the pharmacy. Oh yeah, believe me. Actually, yeah, we don't want everybody to be a nurse or a doctor. I'll tell you why. Because there are other ancillary services that have to be provided.
That's right.
In the same way in your hospital, not everybody works in a hospital as a doctor or a nurse. We need housekeeping. We need, all the ancillary services. So it's very important. We actually want people who are not in healthcare to come and join, because they too have a role to play. It's a family, and everybody has a significant role to play.
Michael Johnsonberg. Yeah, Ghana Medical Relief Mission at Anomabo was awesome, and great job we did.
Yeah.
Samuel Broby also says you can volunteer even if you are a non-health professional.
That's right.
Thank you guys for your comments. Keep the comments coming in if you have any questions. Dr. OWUSU, I mean, he is so he's jived up for this.
It's remarkable. It's exciting. I mean,
the money I used to buy my eyelashes, I'm going to start donating it, and my lipstick.
Okay? we could get a whole lot of prescriptions from that.
I'm so inspired.
Yeah, it is. It's a wonderful program. I mean, those of us who are in healthcare do this because we certainly want to provide care for people. And I think for us as Ghanaians, this is a wonderful opportunity for us to do something that we're already doing here, back home and get an even better response. Like you said, this is helpful for young children, our sisters and brothers, and other kids at home to watch and see how we are making an impact, not just here in the US, but even in their own lives. And I think, anybody who's been in healthcare understands one thing and one thing only. We do this because we believe in it. What we do makes a difference. What we do really makes a difference. And I couldn't think of anything more significant than providing care for the people who are less privileged. And we are fortunate that the people who are the non-Ghanaian, the people who come from the US, such as Central Pennsylvania, other people who join us, they want to help us. So why shouldn't we be there? And they are offering their help for us.
Right.
So absolutely, we need to do this with them. We need to do this with them. And so we are really excited that we have the opportunity to do this.
Okay, Denise Tibbons.
Yep.
Yeah. I took my daughter and it was an awesome experience.
Yes. So So Denise is an X-ray tech, and she brought her daughter, a 16-year-old, with her, just like we're talking about.
To Ghana?
Yes, they went with us at
Wow.
Anumabo. They were fantastic. And her daughter worked in the pharmacy all that time, and now she wants to go to nursing school. So it works. I tell you, this is how we're changing people's lives. Denise was amazing. And this year, so when Denise came back, she did a presentation to her church about her experience. And this year, 4 more people from her church signed up to come with us. Of course, we had to cancel the trip, but this is how word is getting around.
Dr. OWUSU, the way you are signing people up, please don't stop my start. The way I'm looking at things.
Yeah, it's an unbelievable experience.
Johnny Wood says, great show. Emma OWUSU Kumi, we are a family at Ghana Medical Relief. If you come with us to Ghana, I promise you will want to come every year. Ibrahim Mohammed says, please, can I introduce you guys to a friend who want to visit Ghana next year?
Absolutely.
She's actually a nurse in the States. If I can, please, how do I get in touch with you? Thanks.
Yeah. So Ibrahim, if you go to our website, you can just send me your email and contact number. There's a form out there your friend can fill out. And once we have her on our list, and we can send her updates, or just the updates will also be on our website. But yes, just go to the website. There's a form. Tell us you're interested. We'll call you and talk to you, and we'll keep you up, informed of any updates with our program.
Thank you, Dr. OWUSU. Emma OWUSU Kumi also says, we loved Denise and she was awesome.
Yes.
Wow.
Yeah, it's fantastic. It's fantastic.
So, Dr. OWUSU, I want clarity with something. You are saying there's no cutoff date for those for the number of people you want to take.
Right.
So are they going to get their own tickets?
So this is what happens. Once we know you're interested, what we do is we work with a travel agent in Maryland, and what the travel agent tries to do is get us a ticket. It's usually difficult to get a discount, but we used to work with South African Airlines. We'll see what happens to them. But so the reason why we want to know early is because we want to make sure the agent will want to know how many people are going, a down payment for the ticket, so that we know how many people are going, so we can get a discount if it works. But we certainly want to know by a certain date if you're coming, so we can secure a ticket. All right, so that's why. So we don't have a cut-off date per se, but once you're interested, we give you some guidelines. We have certain dates in place where you have to sort of have a deposit of the ticket and things like that down, so we know for sure you're coming. Because what happens is, if, for instance, we know that OFORI is going to be our pharmacist this year, we want to make sure he's coming. We don't want him to, in the end, not show up. So it's nice so we can put people in certain places, because, it's a huge program. Somebody has to cover urology. Somebody has to cover, there's a doctor coming for general surgery, so that doctor will need a nurse. So once we assign you as a nurse, if you can't make it, we need to know. There's a doctor for urology, doctor for obstetrics, gynecology, pediatrics, and so we really want people to be committed and to keep their, so that if for some reason you can't make it, we also want to know early so we can find a replacement for you. So yes, we want to make sure, and once we have your number, there are some deadlines that we will sort of expect you to meet. And what we do is we also put all our passports together and get the visas from the Ghana embassy here in Washington. They are very helpful. They know of our organization and they sort of take care of it for us. So things are done in bulk and in batches. So the better the commitment, the smoother things run for us.
So do the Ghana government know the good things you guys are doing?
Well, actually, if you go on our website, last year, President Kufuor invited us to meet with him. And so we took some pictures. Then President Kufuor, the Kufuor Foundation now is looking to join us in the upcoming event. So that's where we are. Unfortunately, it's been very difficult to sort of get the government per se to work with us. And I hope that in the future they will be able to do that, because as I said, it's very disturbing when we get to Ghana, we have to pay to get our stuff out of the port and things like that. I think that it's very disturbing when I have to pay duty at the port to get medical supplies out just to go serve the community. And we've always, but I think that hopefully in the future we will get, the right people involved. What we, however, do not want to do, what we don't want to do is align with one political party, because we certainly don't want to turn this into a political issue. And so we will work with the Ministry of Health as best as we can, but we don't want to make this a political party event. And so because of that, it can be a little bit tricky. I think if we were to sync with one party, maybe things will go smoother for us. But we think what we're doing is so important. The stakes are so high that we cannot turn this into a political event, and that's what we are not willing to do.
Okay. I think Dr. OFORI and Mrs. Eunice have questions for you.
Sure.
Eunice wants to go first.
Oh, what I was going to say is, could you explain to everyone how you choose the village? Because sometimes people may think there's a little bit of bias, but what's the process you go to when you look at Ghana and you choose the village?
Okay, so this is what we do. First of all, we can go to any village, it costs you nothing. For instance, if Dr. OFORI tells me, hey, can you come to my village? I'll say, fine. There are a couple of things I need to know. One, when we go to that village, I need to make sure that Dr. OFORI will be there that week. Because once I get to your village, I need you to make sure that you can help us make all the arrangements we need when we are in your village. It's very difficult when you get to Ghana and go to a village and the leaders in the community. You have to know these people and things like that. So, and you have to help us secure accommodation. We don't charge you a fee for it. Absolutely not. We also want to make sure it's such a big group. I mean, we're bringing about 60 physicians and surgeons to your village. So we want to make sure that there is a need. Again, our motto is providing healthcare one village at a time. So we want to make sure that you're in a location where other villages will benefit from it. We don't want to do this in Accra or Kumasi. They already have the big hospitals. That's not where we need it. We want to go to a village where there are several other communities that can come in. So when we went to Anumabo, for instance, there are several villages around Anumabo that we're able to pour in. That's what we want. I cannot bring 60 doctors and nurses to a small community and not have enough people to provide the care for. That would be a waste of resources. When we went to Isiakwa, for instance, Isiakwa is surrounded by numerous villages. So we want to go to several villages. I want to go to the north. I want to go everywhere. But I need somebody who is from that village to lead me there. Okay, so it costs nothing to go to your village, but you have to participate. You have to be there with me. You have to help us secure accommodation. You have to be there that week so that you can help us manage, our resources, then sort of work with the community to get the most out of it. We cannot just go to your village and not have you show up. I mean, after all, we're doing this in your honor. And when we go to your village, we say that. So Anumabo, we went to Anumabo because there's a gentleman by the name Raxon, who's a dentist, who came with us. He's the vice president of the organization, and also there's Mr. Otu, is a Ghanaian he's done a lot of work with the Anumabo Clinic, and we were very honored to run this program in his honor. That's what we do. So we want Ghanaians here to take us to their villages so we can do this in their honor, and it costs them nothing. All they have to do is be there with us so we can navigate through the process while we are in their village. I mean, and I don't think that's too much to ask for.
I'm so happy you said that. So I want for all the viewers who are listening, if you know the places you are back home and it needs assistance, please reach out to this organization, because they do want to help one village at a time. So, and I really admire the fact that you talked about it not being political. One thing I really faced when I was in Ghana is that same thing about, paying money at the port. And we actually had a meeting with some of the people, and they said, oh, if you do this or you do that, you won't have to pay. But definitely something that needs to be taken to a higher level. When people are donating their money and you don't even know how to get money. Look at what you said, that people donate. You don't know what kind of job they do here, how much they've been saving. So the least that they can do for us when we go back and give free services is not make us pay for things at the port. Absolutely.
It's really interesting. So when we do this fund, there are people here in Central Pennsylvania who do, I mean, Denise at her church, they had spaghetti dinners. They were doing auctions, and just so they could raise money and come on this trip with us. It was fascinating. I mean, they were doing church spaghetti dinners. They were doing bake sales so they could raise money and buy prescription drugs for us to come to Ghana and give it out for free. I mean, so it's really fascinating that they were doing this for us. And yet, when I go to a Ghanaian church and tell them about our program, I get no response. So so it's fascinating. Yes, so true. This is what they are doing to come help us, so we can do better. I think we can do better supporting not just Ghana Medical Relief, but other programs like this that are intended to go back and provide care for our brothers and sisters back home.
Absolutely. Dr.
Yeah, so my question is a very interesting one. So has it come to a point where you are like, man, I want to give up on this? Did you ever have that?
Yes.
Well, listen, this started in 2011, and there were several times when I asked myself, why am I doing this? I'm a doctor here. Life is good. Why do I do? But every time, I would think that way. I would also be reminded of the fact that this is just not good enough. I cannot just be a physician living here and sort of not giving back. And I have always felt that this is something that we needed to. As I said, my wife is a nurse, and that conversation kept coming back.
Mm.
Oh, there's been several hurdles, but by the same token, we are always fortunate also to have people who continue to encourage us. And like all good things, if you keep paying attention, keep your eyes on the prize, I think you get there. So we've been very fortunate. Yes, but absolutely, it's not easy at all. It's not. There's been several. I can tell you stories of, even my own. I have a lot of Ghanaian physicians who say to me, "Why are you bothering?" and things like that. But when we do it and we come back and we show them the pictures, they are surprised that we've been able to do something like that. So I think you're always going to get that kind of response, but like anything else in life, it's just like choosing a profession in medicine or pharmacy. It's not going to be easy, but in the end, it will be worth it. And I think that's what we look at. And and having an opportunity like this to talk to folks like you and share our experience with you makes it worth it. So I'm proud of that. Yeah.
Awesome.
Dr. Also, do you have a pharmacist here? Because I want to sign Dr. OFORI up.
Well, he's welcome. Yeah, we usually years ago, we got a pharmacist from Maryland. In the last few years, we've been getting a pharmacy tech. But yes, we certainly will love a pharmacist to join.
Right. So that brings me to the question of like medications.
Yeah.
I understand you bring some from the US and when you get to Ghana, how does that go?
Right. So when we get to Ghana, you have to go through the FDA in Ghana to get the prescriptions out, and it's a big hassle.
Okay.
But what happens is, because I work for an institution here, the hospital allows me to buy drugs at cost. So the hospital allows me to, they will order the drugs for me, so I get it at cost.
Okay.
But if I can get, and I know in Ghana there are things like NS Chemists and other places.
Yeah.
Well, believe me, it's not that easy to work with them. So, I want them to donate the medications. But
right.
So so I sort of have to compare prices. Sometimes it's easier for me to get some medications in Ghana. Sometimes it's easier for me to get it to the pharmacy. And sometimes I just go to Sam's Club and buy bulk. So I don't know.
Over-the-counter medications.
If you have Sam's Club in Chicago, it's similar to Costco. And we buy. So there's a lot of cost comparison because we want to be able to get as much for our buck. And so, and then we decide on that. And then, there's some medications that obviously get, donated, but a lot of the medications we have to buy. A lot of our expenses goes into medications.
Right. Yeah, that's why I was saying, the medication plays a major role because it's, people in Ghana, when they go and you give them the same FPAC and NS Chemist medicine, they will say, oh, Abrucefon, they didn't give us the Abrucef medicine, right?
Yeah.
So, it's a very psychological trick.
What we also do that I think makes our program fascinating also is, so we run the clinics, and then because a lot of the most of the people come, so we don't just we have physicians, nurses, and volunteers from the US, but we also work with some doctors in Ghana. Over the last 2 years, we've had several physicians who work at Rich Hospital, Kolibu Hospital, who know about us, who schedule their vacations, they're Ghanaian physicians, so they can join us. And because they learn a lot from us. Dr. Pati from Rich is really helpful with that. So he puts together a few doctors in Ghana who come to join us, and we also have nurses who come to join us. And then what we do is at the end of the program, we spend 2-3 days just touring Ghana. We take them to the castle, we take them to certain places, because most of them are from the US, and we show them Ghana. So we built some kind of tourism into that. So it makes it fun.
Nice.
So we try to have some fun as well. Yeah.
Right. And then one last question is, so how do you assess preventative medicine in Ghana? Because that's one thing that I think is killing a lot of our people. There are a lot of diseases.
So what happens is that, so in Ghana, if you set up a health system like that, once they know people are coming from abroad, the good news is this: one, obviously those people who are ill will come in, but then most people just also show up, and so that's why we're able to do some of the screening. So when you come to our clinic, we have at the triage, we have people, we are screening everybody. Everybody gets a blood pressure check, and then we ask them why they are there. So if we find that you're sick, obviously, if you're a kid, we send you to pediatrics. If you're there for, say a toothache, we will still take your blood pressure anyway and send you to see the dentist. And then if your blood pressure is high after that, a volunteer will bring you to the medical clinic and get your blood pressure taken care of as well. So we try to do that. And then there are people who will just sometimes show and say, "Oh, I'm not sick, but I just want to get checked out." Sure, we'll take their blood pressure as well. And then most people are surprised that they have such high blood pressure because they don't have any symptoms. So by so doing, we get some of that screening in place. When we went to Anamabo, for instance, we went to Agri Memorial Screening School and we screened everybody. So that by itself was a huge screening. If you go to our website, it was big. We screened everybody. Everybody got examined. So that's the kind of thing that we do. So we end up doing a lot more screening than you think. But yeah, so when we get there, like I said, people who are sick have a different line, and then people who just want their blood pressures screened also get screened. So that's how we get a lot of the screening in place.
Okay, great.
Okay, Dr. Wu,
thank you.
Mr. Black Jesus wants to find out, in Ghana, do you get volunteers from like the Ghanaians in Ghana?
Yes.
Do you get sponsorship and volunteers joining you?
Right. So when we go to any community, like I said, we have volunteers from the Ghana Health Services. There are some doctors and nurses who join us and they continue to tell their friends. So we do that. And then when we go to every village we go to, we try to recruit the young people there to help us with the screening. So, for instance, when we went to Anumabo, the Queen Mother called all the secondary school kids to come around. It was nice to see them, and we taught them how to do blood pressure so they could help us with the screening. Because what I didn't want to do, for instance, is take nurses and doctors from the US to be doing triage. Instead, we had them seeing patients, and then the first evening, we trained them how to use our blood pressure machines and how to take chief complaints. So all the young people, and they loved it. The young secondary school kids who were on vacation learned how to take blood pressure and would write complaints. Patient is here for a headache. One, because they speak their language, you see, so they can talk to them. If you're in Accra, they can talk to them in Ghana. If you're in the Volta region, they can talk to them in Airway, whatever. So people from that, and this is why it's so crucial for us to have a representative from that village come with us. So they put together that young group of people who will sort of help us with the screening. And so when they do that screening, then when they get inside the clinic, they can see the people who are there to provide the care for them. So so it's really important that we get young people from that village to take place, to help us. And besides, that helps us. So then we feel like we're part of the village too. When you go to any village, you want to hang out with the young people, right? Why not? Yeah.
Okay. Some comments online. Samuel Broby says, also after the health screening program, there are 2 days reserved for visiting interesting tourist sites in Ghana.
Right. That's what we talked about.
Yeah, we talked about that.
Yeah.
Benjamin Ankama, I have had the opportunity to work with Dr. Sam and Mrs. Cromwell last year. It was fantastic and a great experience. Keep the good work. They are good mentors. We need to learn from them. I'm encouraging everyone to support their medical missions. I can't wait to see you all next year, especially Dr. Edward OFORI.
Yeah. So yeah.
As a special invite.
Yeah. So Benjamin is somebody we met when we went to Anumabo. I think he's a PA. He heard about us, and he just came to join us. And so we met him there. And so it's really fascinating. Sometimes I get email from people in Ghana who either saw us on our website or heard about us, and they want to know if they can come and say, sure, I just need to know so I have a place for you to stay. Because they're coming from different regions. So Benjamin, I think, came from Kumasi. He heard about us. He joined us. He stayed with us that weekend. He had a great time. He was fantastic. It was fantastic.
Nice.
So yeah, we continue to expand our family, but everyone is welcome. We have work for you to do. If you show up, we will find work for you to do. Absolutely.
Emma OWUSU Kumi. As nurses of GMR, we do lots of education while they are waiting to see the doctor, and after they have been seen by the doctors.
Yeah.
Johnny Woods, Live, Love, Laugh, sent us 3 hearts. Johnny Woods, are you provided any kind of security protection when you're volunteering work in Ghana?
Well, I don't. Well, I think that, so when we go to a community in Ghana and we are in that community, I don't think that our lives are at risk. I mean, I think that, again, because we go and we work with the community and we have somebody from that community leading us, I think we usually feel safe. I don't think I've ever felt threatened, and our guests do not feel threatened. So, and again, we certainly want to make sure that they're in a secure location and that they are safe. But no, we've never required any special security for any reason. I've never felt the need for that.
Emma OWUSU Kumi, Benjamin was such a hard worker.
Yeah.
Michael Johnsonberg. I was GMR pharmacy technician last year, and it was a great feeling.
Yeah. So Michael is also somebody who sort of joined us last year. He heard of us from the previous year, and he came in as a tech, and he was fantastic. He did a great job for us. And I think he worked for EUNICE too, right? He worked for you as well. Yeah, he's great.
Yeah, Mr. Black Jesus also wants to know if you get sponsorships from Ghana, maybe like Despite, TV3, TV coverages, news coverages, those. Do they sponsor too?
Well, they're always happy to put us on their news, but and we were on the news several times. Well, on the news several times in Ghana, but we didn't get any sponsorship from them. But hopefully in the future, they will be able to do that for us.
You know what is amazing me about you, Dr. OWUSU? The way it looks like you can remember everybody's name that you worked with.
Yeah, well, it's important. It's important when you work. So again, just like a family, you have to make people feel like a family if you're going to put them together and do this sort of thing, or else it will not work. And so it's important. We really spend time with these people. So and the setup allows me to do that. We all stay in the same place. We wake up together in the morning. We eat breakfast together. We go to clinic. We work together. We come back home. We eat dinner. At lunchtime, we go around and we don't break for lunch. So I go around and I have my sandwiches. We bring all this stuff from Sam's Club, candy bars and sandwiches and, all kinds. And then we pass it around. So I have to know everybody's name. I have to make sure nobody gets doubles, right? So we pass around snacks. And then in the evening, we all go out and we eat dinner and we stay together. So by the second, third day, you know everybody. It doesn't matter. Even you walk because you're with them in that vicinity. And so it becomes a very close-knit family. And like I said, there are people who've been with us 5 years in a row. So you get to really know them. You know them and you know their family members.
So do you get cooks that volunteer to? What kind of breakfast are we going to be talking about?
Well, so actually, I don't know. There is a restaurant in Virginia. It's called Abri Gardens. I don't know if you know about it. Abri Gardens is a fantastic restaurant. It's owned by a Ghanaian. And she, in the summer, she's also she comes with us and cooks for us in Ghana. So we travel with our own chef. Don't forget that.
Oh wow!
Yeah.
Oh,
So she comes.
really
So she comes with us. Janet OWUSU. So she comes. She owns a restaurant in Virginia. It's called Brew Garden. It's a beautiful, fantastic. If you ever get to Virginia, Woodbridge, make sure you stop by. It's actually been on Andrew Zimmerman's show a few times. It's really a fantastic Ghanaian restaurant.
Okay, maybe you should connect us so that we can interview her too.
We should, and she comes to Ghana with us, and she makes sure that, you know, as she likes to put it, Americanize our meals for us. Because so because, you know, it's kind of, you want to make sure that people who come with us can, you know, will be comfortable and can eat well, and so she really makes. So when we ship stuff, we buy a lot of stuff from Sam's, like food supplies, and we ship it with us.
Wow.
So when we get there, she makes sure that the food is, you know, as I like to say, up to par. And she does a fantastic job. If you go to our website, people comment a lot on the food. It's really interesting. A lot of our volunteers comment a lot on the food. They had a great time. They love Janet's cooking. They say that. So we do that. So when we get there, we get we again, one of the expenses we have to make is we get a caterer, and Janet works with the caterer and makes sure the food is, you know, but the meals are good. The meals are
that
really
is
good.
why it's very important, viewers, for us to donate.
Yeah.
You know, I mean, this is a lot of things they need to take care of.
It takes a lot of coordination, but, you know, we've done it so many times that we have things. We have things. Our operations manager, Richard, does a fantastic job. Richard is an engineer who used to work for, so he's not a doctor, but he's an engineer who used to work for Chrysler. So Chrysler is a car manufacturing plant. So he puts this thing together as if he's building a car. I mean, they're very, like, you know, there are all these blocks. There's, you know, it's like it's an assembled plant for him. He's really good. You know, he does a great job. And Sam Brobe, who has been our project manager. He's been our liaison for years. They do a fantastic job sort of coordinating events. So it comes together very well. For
a second, I thought you were going to say they donate Chrysler to the volunteers too. Like,
not yet. Maybe one day we'll get a Chrysler truck.
Oh my God.
Maybe one day we'll get a Chrysler van or something.
Yeah. Some of the more comments are coming in. It looks like a lot of people love you, Dr. OWUSU. A lot of people. Someone is saying, I worked with Michael in the pharmacy and he was fantastic. Looking to working with him again. Emma OWUSU Kume, the nurses are so busy we hardly eat lunch. LOL. Dennis Tibbon said GMR is family.
Yep.
Abigail Onwa says Ebri Garden rocks.
Yeah.
Emmanuel Donko, great man of all standards. Anamabu Health Center is grateful for your support. Michael Johnsonberg, also pharmacy technician for Jemima Nunu Foundation. Mrs. Eunice CROMWELL is doing a great job at Anamabu, and during this COVID-19 pandemic, she donated PPEs and pediatric medications to Anamabu Hospital.
That's wonderful.
On behalf.
That's wonderful. That's great job. That's great. That's wonderful. That's really
wow.
Good. That's
I
great.
guess she's an angel everywhere.
That's right.
Abigail Onwa, donate. Abigail Onwa also said Richard and Sam are the best project managers. Yes. It looks like
Abigail and her husband Frank that have been our greatest supporters. They've been very generous to us, and over the years they've donated tremendously to support us, and we appreciate it very much. Abigail, a couple of years ago, came with us and actually worked the clinic with us. But Abigail and her husband Frank have been they have been fine. They've been fantastic. So I want to take the opportunity to thank them once again for that generous support. We appreciate it.
So Dr. OWUSU, is there a way we can use our credit card on the website?
Yes. There's you can use PayPal on our website. Yeah.
Oh, PayPal.
Yeah. Right.
Okay. Sounds good. If we have no more questions, we'll take a little break, and then when we come back, Dr. OWUSU we'll all give our closing remarks, and maybe we can break this. This was fun, right?
Oh, great. I enjoyed doing the show. Thank you.
Okay, guys, don't go anywhere.
It's here for me, Chiamo, guys. Afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Bibiansa sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Ja, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Wati. Rocks watchy. The original is there. In the second demo. Yep. Powder for Fukramudi, so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a bit paiju.
Hello, Dr. Amina. How be?
Adeo, Adam. How be you too?
How we go do am? At the call sake of the other time you talk, say you go explain the vaccines thing give me.
Oh yeah. So everybody get immune system which they protect we from infections, right? Take say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines, dear, we start to use no be today. If the vaccines help we fight the 6 childhood killer diseases safe.
So why people they talk say vaccines no good?
I tell you say no be true. Vaccines be safe, why? Some people they react badly to vaccines, but that be rare, cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. In no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure time soon?
Righty, research advance, wow. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why them won't try the corona vaccine for only Africans wanna talk?
The French doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we not gonna know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, we for make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kai how you go protect your body from corona.
Oh yeah, at the Kaiwa, I go stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Hello again, everyone, and welcome to the health segment on Trend Africa TV. We've had the honors of hosting the beautiful Mrs. Eunice Cromwell once again, Dr. OFORI, and our special guest, Dr. Samuel OWUSU. Dr. Samuel OWUSU, could you please tell us the date, location, and time frame for next year's mission?
Yeah, so we're gonna what we do next year, God willing, if we have this pandemic under control, we will leave here the last Thursday of July, and then that runs in, and then return the first week of August. It's usually a 12-day mission, and if you go to our website, you can see the dates. But that's when we plan on leaving, and we will have a list, the itinerary and list of events that will take place during that time. So that's when we will be doing. We will leave the last Thursday in July, and then return the first week in August. We are looking forward to a really robust program this year because we suddenly missed this next year because we missed this year. And our services will include obstetrics, gynecology, pediatrics, internal medicine, general surgery, ophthalmology, And we also, as we've always done in the past, continue to provide services, and we will provide CPR training. We will also continue to give seminars on topics like hypertension, diabetes, malaria, proper dental hygiene, and things like that. So it's going to be a really robust program, and I think that anybody who has the opportunity to join us will be pleased with how wonderful a program it is, and I think that if you go to our website and see some of the comments, I think it will be a worthwhile experience for anyone to take part. Obviously, those who cannot make it can support us, and as we've been talking about, it's important. We're able to do what we've been doing because of generous donations from people like you. So that's important. If you can't make it, you can still support us.
Thank you, Dr. OWUSU. Do you have a venue already? Which village are you going to?
Right. This year we'll be going to ATBA Kwel in the Eastern region. That was where we were going to go this year and didn't make it. So we are keeping that venue the same for next year. It will be at ATBA Kwel in the Eastern region.
So when are you going to the Volta region? Because I have to fight for my people too.
We need a representative to take us there. And if you want us to go to the Volta region, we can start talking about it. We just have never had anyone who would lead us there. So if you're interested in taking us to the Volta region, this is your chance.
Yes, we are going.
That's what I want to hear. And if you're interested, GMR will go there. Will be there with you.
Okay. I can. Okay. So let's read some of the comments here. Christine Kumi, volunteering with the GMR pharmacy was a great experience to introduce me into the healthcare world and serving the community. I loved it. Okay, Reggie Rackstone Wache, I think that's about it. Okay, Dr. OWUSU, can you please give us your closing remarks and how are you going to encourage people to sign up?
Yeah. So once again, thank you for this program. I think it's been wonderful to be on the program. It's nice to meet, people like you doing the work you're doing. I think that your work is just as important. So I applaud you for that. I think for me, and I say this to my children all the time, I think it's not enough for us just to provide for ourselves and our family and our loved ones. But I think everything we do, has to be something that can be a blessing unto others. And I think that's how we make a difference in society. And I think for those of us in healthcare and whatever field you're in, I think this GMR offers a unique opportunity for you to be part of something that is really significant. I think that when we're able to do these things, where we go to Ghana and offer healthcare and help people who otherwise have had no healthcare, we make a tremendous difference in their lives. And then, as I said earlier, it's nice when we see young people in that community who also look up to us and see that they too have a future. They too have an opportunity to make a difference in the lives of others. So I think for me, this is how you become part of a community. This is how you make a difference in people's lives. And this is how your life becomes a blessing unto others. So this is why I do what I do.
Thank you so much, Dr. OWUSU. I know you had a long day today and then you still took time off to be on the show. Thank you so much. God bless you. And my regards to the family.
Thank you.
Okay. Mrs. Eunice Cromwell, Dr. OFORI, what do you guys think of the show today?
Power packed. It was so nice to hear from him and to just really understand everything this program is doing. I'm really inspired, and I hope everyone who's been watching can really just take this, and we should all be able to give something back. I always say that no matter how busy you are, no matter how little it is, we all have to look at ourselves and say, what can we do for someone else? Because that is the way we get our own blessings. When you are able to be a blessing to someone else, you will also get blessings. So I'm inspired by listening to him. I was inspired by hearing the whole story. I actually met his project manager, and he helped me with a lot of stuff before I went to Ghana. So I had known a lot about them, but never really got the chance to sit down with them. But I'm overwhelmed and I'm grateful. And I love healthcare, so this is my favorite program. So very excited.
So is that your closing remark too?
Yes, that's it. That's all I've got for you guys. Thank you so much for tuning in. We love you guys. And don't forget about the virtual health fair.
Yes.
Virtual health and wellness is going to be October 22nd. And we have so many amazing speakers coming on. We have people from all over, from Virginia, from New York. We have people from Ghana. So very, very good. Please tune in, make a time, invite your friends and family, share the link, and we're going to have a lot of fun. Thank you.
It's going to be fun-packed.
It is.
Thank you, Eunice. Have a good night. Thank
you.
You so
too.
much.
Thank you.
So, Dr. OFORI, over to you.
Yeah, well, so I didn't stay the whole entire time, but I think this was one of the best shows we've had so far.
Yeah,
very educative. So I entreat everybody to keep sharing the feed, share the good news, because what we're doing too is, is some way of like giving back to the society, right? Education is very key. Yes. So I will encourage everyone to stay safe. COVID-19 is still around. Let's make sure that we protect ourselves and our family and neighbors. And hopefully we'll meet in 2 weeks' time. Thank you.
Thank you so much, Dr. OFORI. Have a good night. My love to the family.
All right. Sure. Thank you. Me too. Mm-hmm.
Okay, viewers, this is Empress MAWUSI on Trend Africa TV. Please, the least you can do is share our feeds, and invite people to watch and like us. Do you also have a commercial you want us to play on our programs? Or you can call us on 773-312-0318 or 773-756-6678, and we can work a commercial with you, or just give us a little donation. Or if you feel from your heart you just want to donate something to Trend Africa TV, please feel free, call us and just say, hey, you know what, I think you guys are doing a great work in the community. I want to donate $1,000, $2,000. I mean, bless us. We are really investing time into making this a very educative TV, online TV for the community, the African community here and abroad and in Ghana and everywhere, so the least you can do is just any coins you have, just donate to us. And guys, I'm just gonna advise you, let's continue to be safe. Please go for your flu shots. The flu shots are going out now. Go get your flu shots. You don't want to, be feeling sick and in the midst of all this COVID-19 thing going. So, take care of yourselves, and my love to your families, and good night.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us at Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123, or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.